So we start from the retinal disorders. First one is age-related macular degeneration. Degeneration of macula, central area of retina, loss of central vision, scotoma. Two types: dry, which is most common, and this is gradual decrease in vision with subretinal deposits. Bruisons are formed, as you can see in the picture A. Picture A. Yes, these are the trusons and scotomas. Wet, rapid increase in rapid decrease in the vision due to bleeding. Secondary to choroidal neovascularization. As there is bleeding, secondary to neovascularization and bleeding, you can see is wet, so this is wet degeneration. And it results in distortion of straight lines, metamorphopsia in an early symptom. So the early symptoms is distortion of straight line, which is called metamorphopsia. Then is diabetic retinopathy, chronic hyperglycemia, which result in increased permeability and occlusion of retinal vessels. Two types: non-proliferative, which is most common, and proliferative. Non-proliferative is in this microaneurysms and hemorrhages are formed, as you can see in the picture, microaneurysms and hemorrhages. So these are the hemorrhages and microaneurysm. These are small dilatations. This is the dilatation and this is dilatation, which then would result into hemorrhages. And cotton wool spots, hard exudates. These are the features which we can see on the picture. Vision loss mainly due to macular edema. The next type is proliferative. It is retinal neovascularization. As you can see in proliferative type, there is proliferation of the vessels, which result into neovascularization due to chronic hypoxia. Abnormal new vessels may cause vitreous hemorrhage and tractional retinal detachment. The next type is hypertensive retinopathy. It results from chronic hypertension. It has characteristic or features of spasm, sclerosis, fibrinoid necrosis of retinal vessels. Fundoscopy show arteriovenous nicking, microaneurysms, hemorrhages, cotton wool spots. Hard exudates can also be seen in this, may form macular star. Red arrows in C, you can see in the picture red arrows. Yes, these look like macular stars. It presents with papilledema and it is indicative of hypertensive emergency and warrants immediate lowering of blood pressure. So if a hypertensive patient come to you with the loss of vision and you do fundoscopy and on fundoscopy you find papilledema, so this is the indicative of hypertensive emergency and you should immediately lower the blood pressure. The next is the retinal artery occlusion, blockage of central or branch retinal artery, usually due to embolism, carotid artery atherosclerosis, more than cardiogenic. Less commonly due to giant cell arthritis. So it is also a complication of giant cell arthritis, but it is less common. Presents with acute, painless, monocular vision loss. Monocular means single-sided vision loss. On fundoscopy, we can see cloudy retina with cherry red spot at fovea, identifiable retinal emboli, cholesterol crystal appear as small yellow refractile deposits in arterioles. So these are some features you can see on the retinal artery occlusion. Retinal vein occlusion. Central vein occlusion is due to primary thrombosis. Branch retinal vein occlusion